COVID-19 pandemic means for refugees. If you are participating, please mute your mic. Please also note that we are recording the webinar for those who cannot be with us synchronously. All our webinar recordings can be found on our YouTube channel, and we will post the link in the chat. I am Deniz Duriz, a sociocultural anthropologist working with migrant farm workers from the Kurdish region of Turkey and Syrian refugees in Turkey and in Europe. At Northwestern, I'm the postdoctoral fellow of the KEMA Modern Turkish Studies program housed under Buffett Institute for Global Affairs. My co-host for the series is Galia Ben-Aryeh, a professor in the Department of Political Science with over 20 years of experience in refugee studies as an academic and a lawyer. This series is part of the new Colloquium on Refugees, Migrants and Statelessness that is one of the working groups within Northwestern Center for International and Area Studies. The Colloquium is the new generation of the Center for Forced Migration Studies, founded by my co-host Galia Ben-Aryeh, and works to broaden our understanding of the realities of refugee flows, asylum seekers, conditions of statelessness, internally displaced peoples, and development in climate-induced migration. The webinar series is made possible through the assistance of Danny Postel, Assistant Director of the Center for International and Area Studies, and Cindy Pingree, who provides administrative support to our faculty research groups. While those of us in the United States in our homes alone or with loved ones wish we didn't have to be participating in global-wide stay-at-home orders, millions of refugees around the globe have no home and live in crowded UNHCR or state-run refugee camps, detention centers, and makeshift urban tent cities without access to clean or running water in crowded living conditions. For hundreds of thousands of others, the slim hope of being reunited with family or being granted one of an increasing limited ticket to a life in a new country as resettled refugee is now gone in the face of travel restrictions and closed borders. Through this series, our hope is to raise community awareness by bringing you speakers from the front lines, advocates, practitioners, and refugees who can fill you in on their situation. Prior webinars brought information about the front lines in Greece, continuing work of UNRWA and Palestinians in East Jerusalem, and refugee advocacy in Chicago. Next week's webinar features Patricio Nabucco Martuccelli, who will be talking about COVID-19 pandemic experience of refugees in Brazil. Today, we will hear from an organization that provides remote social support for refugees in Canada. The format for today includes 7-minute introductions by our speakers. I will then moderate a conversation with our speakers, and we will then open up the forum for participant questions. Please post your questions in the Zoom chat box, and my co-host Galia will be monitoring the chat to collect your questions for the Q&A. Our speakers for today are Anna Hill and Andrew Lusztyk, co-directors from the Together project, Remote Social Support for Refugee Claimants and Government-Assisted Refugees in Toronto, Canada. Anna Hill is the management lead for Together project with a focus on resource development, communications, and community programs, including the Welcome Groups for Refugee Claimants pilot program, the Urban Nature Access Pass for refugee newcomers, and the Ritz-Carlton Newcomer Hospitality Program. After working in architecture for a decade, Anna moved to nonprofit sector where she was involved in programs like the Weston Family Parks Challenge and the TD Park Builders Program at Park People. Her experience with newcomer engagement in parks and as a private sponsor led her to co-found Together project and develop its community programs. Andrew Lusztyk is the program's lead for Together project. Prior to moving to Toronto, Andrew spent 6 years designing, implementing, and assessing community development initiatives in 3 continents. Since co-founding Together project, He has been developing and directing its flagship welcome group program across Ontario. Anna and Andrew, I will now turn over the mic to you for your introductions.
Okay, let's see. Okay, can everyone see the screen? Yeah? All right, so I want to begin by thanking Galia, Dennis, and our hosts at the Colloquium on Refugees, Migrants and Statelessness, and the Center for International and Area Studies at Northwestern. Thank you for including Together Project in this series on what the COVID-19 pandemic means for refugees. So this week is actually National Volunteer Week in Canada, and because of this, we are especially appreciative of the opportunity to talk about Together Project's model of volunteer engagement in refugee integration and how we have adapted our model to one of remote social support in response to COVID-19. Oh, okay. So Together Project was founded in 2016 in response to the large influx of Syrian refugees into the greater Toronto area. We are a charitable initiative of Tides Canada. Together Project's mission is to connect refugee newcomers and Canadians to build more stronger and integrated communities. And we do this primarily by connecting welcome groups of 5 or more volunteers with newly arrived refugees from any country of origin, not just Syria, for 6 months of social support. Before the COVID-19 pandemic, we also hosted community events and programs to foster social inclusion. We also work with academic partners to try to conduct evidence-based program evaluation that's continually helping us refine and strengthen our program delivery. So today I'm going to very briefly comment on how refugee settlement in Canada works, how our work is addressing or filling a gap, how our flagship welcome group program worked before COVID-19, and I'm going to talk about some of the impacts we've had to date. Then I'm going to turn it over to my co-host, Andrew, who will talk about some of the changes, how we've responded to COVID-19, how we've created this model of remote social support, our successes and challenges, and some stories.
Stop the share and continue with
that. Okay, great. Okay, so there are basically 4 categories of refugees who are coming into Canada: refugee claimants, or asylum seekers who are not technically refugees until their basis of claim is recognized. There are government-assisted refugees who are referred by the United Nations High Commission for Refugees, and the government sponsors their initial first year of resettlement. There are privately sponsored refugees who are sponsored by community volunteers, a sponsorship agreement holder, or a group of 5 Canadians who offer 12 months of both financial and volunteer support. And then there are blended visa office referred refugees who are a combination of 6 months of government support and 6 months of community volunteer support. So our welcome group program has been designed primarily to address providing support for both government-assisted refugees and for refugee claimants, because these are the 2 groups of refugees who are not automatically connected to a group of volunteers when they initially arrive in Canada. So that's kind of the specific gap that we're trying to fill, is to make sure that all vulnerable newcomers have access to community volunteer support. In addition, we find that many of the volunteers who are participating in our program may be at a point in their career where they don't feel ready to take on the financial commitment of private sponsorship, but they still very much want to participate in refugee integration. So in our program, the Welcome Group program, volunteers are only giving the gift of their time. there is no financial commitment that's required. And so again, many of our participants are newcomers or younger people at the beginning of their careers, whereas the private sponsors in Canada tend to be a little bit older. In terms of our Welcome Group program, we have developed it in close collaboration with our settlement agency partners to ensure that the program complements without duplicating the settlement support that newcomers are receiving from agencies. Working with settlement agencies, our goal is to foster social connections with volunteers that will increase refugee social capital, decrease newcomer social isolation, and to help build more welcoming communities through volunteer engagement in refugee integration. So we developed our model very much based on learnings from the private sponsorship model. So again, we're matching a group of 5 or more volunteers who are providing social support that target specific integration challenges that newcomers have identified. So these integration challenges might revolve around assistance with language learning, access to education pathways, access to employment, access to healthcare, or other challenges that the newcomers themselves identify. Some of the key features of our program include training for our volunteers, specific resources to support things like informal language learning. All of our matches involve a group of volunteers, not just a family-to-family match. We also have a cultural ambassador program through which we match an interpreter who speaks the family's language of origin with the volunteers and the newcomers, and that cultural ambassador provides either in-person interpretation or now interpretation over WhatsApp, because of social distancing requirements. We also have a preference matching system whereby we try to understand the specific integration challenges of the newcomer household, and we match them with volunteers who have similar interests or skills, whether that might be, bringing previous experience with language learning, or maybe a teacher who wants to focus on education pathways, etc. We're very much trying to create compatible matches. And then in terms of how we collaborate with the our local resettlement assistance provider organizations, they refer the government-assisted refugees or refugee claimants to our matches, and they also work with us to help train and support our volunteers. In terms of our impacts to date, we've matched about 130 newcomer households across the province of Ontario. We've delivered our program in 5 cities. Approximately 600 newcomers and 600 volunteers have been engaged in our program. And we're currently involved in one research study it's an academic partnership with York University to look at the impact of our Welcome Group program on expanding the social capital of government-assisted refugees. And we have another research project that is kind of in development. At this point, Andrew, maybe I can just kind of introduce the fact that we've had to completely sort of rethink our model in response to COVID-19, but there is one aspect of our model that has very much informed our current response, and that is that a lot of our social connections between volunteers and newcomers has been occurring over WhatsApp. So we've taken this aspect of our program that was kind of a secondary element, namely connecting volunteers and newcomers over WhatsApp, and we've had to really expand that to include just remote social support, as well as volunteer onboarding, training, and matching for our volunteers over programs or over platforms like WhatsApp. So with that, I'm going to turn it over to my co-director, Andrew Lusztyk, who's going to get into the details of how remote social support for vulnerable newcomers is actually unfolding in our Welcome Group program.
Great, thank you everybody. So I'll get right into it so we can move right along. And I apologize to not have the slides in front of me that you can see, so you'll have to just watch me deliver this. But as Anna mentioned already, remote social support actually has been kind of built into our Welcome Group program from the outset, although obviously in much more of a kind of a support function to date. So generally speaking, you know, through things like WhatsApp and Skype, our volunteers have in the past been connected. WhatsApp especially is kind of one of the linchpins of our match because it provides a platform for both volunteers and newcomers in a match to share resources, to talk to one another, to connect, even to practice English. But now obviously this has kind of had to be augmented. So in a way we've been able to kind of hit the ground running. We haven't had to completely reinvent our program, but we've certainly amplified what was previously a bit of a secondary support element of our program. So in that sense, we have an adaptation basically to a program that's based on previous experience, but now obviously forced through necessity to kind of learn about how to use it most effectively. So like I said, in the past, we've had matches who have been doing things like enhanced language practice via Skype, whether because they weren't able to meet in person or simply because that's where that's kind of the most effective use of their time collectively. Now we've kind of shifted into a larger focus on video chat. And what that typically looks like in terms of what the typical nature of social support looks like remotely, the starting point really is checking in. So it's basically just regular check-ins to see how the match is doing, what the newcomers might need, what the challenges might be at any given moment. The next step to that is kind of a video chat socializing component where people are able to kind of meet face-to-face, so to speak, and to just kind of catch up with one another in person, which kind of works to mitigate social isolation, but also just works to also keep people connected once they've already been connected in person. And then language practice is also a huge component. So this is something where we haven't, again, had to reinvent the wheel. Obviously, video language tutoring has existed for some time, but now we're kind of incorporating it into our regular programming and also learning about what works and what doesn't. So in that sense, we've kind of been put into almost like a forced pilot because we're trying something very new and we're not actually really sure where it's going to go and what necessarily works best. But that's one of the areas that we're obviously focusing on because that's kind of a natural fit for the program. The last one also is service navigation and assistance. So as we'll talk about, obviously, I'm sure in the questions, everything is in flux right now, including regular service delivery. And it's difficult to understand even at the best of times. And now obviously with all the different layers of complication related to coronavirus, it's become more complicated. And so that's where also a lot of volunteers are helping the newcomers in their matches navigate those questions. Anna, can you go to the next slide, please? So this is kind of an infographic that we put together to share both with our volunteers, but also with our partners and even the newcomers that we're still actively recruiting to kind of understand what remote support can look like. The important thing here to flag, obviously, is that this is not necessarily what every match looks like. Every match is based around the different discrete priorities of different households, but this is kind of almost like a menu of options based on the very limited experience that we've had. I mean, it's basically been a month and a half since we've been kind of seeing what's been, where groups have been active. And this is kind of what we've learned have been the main priorities in a lot of our matches. So this is what we're sharing with our volunteers. Next slide, please. So in terms of the successes and challenges, I mean, the important thing to just highlight off the top is that we're still learning. We don't necessarily know what's going to be working and what's going to be the main challenge further on. But in a nutshell, I mean, the main success that I've been very pleased about is just the dynamism of our volunteer base. So given the fact that a lot of our volunteers, literally hundreds of volunteers, are active with us or have signed up for basically a different kind of program delivery. Now we're asking them to shift gears fairly dramatically and to do something completely different or in a different format. We've been really happy to see how willing volunteers are to kind of take on that new role. The next step to that obviously is matches that were already active when coronavirus hit have been maintaining contact and activity in some form. So some have really leapt into this. As you can imagine, some people are more comfortable. Some people are maybe have already been doing this in the past. But you know, my fear initially was that, oh, this is going to stop everything. How can you have social connections without any kind of social interaction. But I've been happy to see that, that things have been continuing on and people have been flexible about how their matches proceed socially. The constraints also actually kind of, like I said about the forced pilot, we've kind of been forced to modify our programming, both in terms of training delivery and how we roll out resources online. So it's been a very useful learning experience for us. We've already kind of learned a lot about different opportunities that we have that we can use in the future. Primarily that last bullet about an opportunity to try out a language practice guide. So we actually, in time with what we've been, research that we've been doing before the coronavirus hit, we wanted to prepare a guide for our volunteers around language practice, so how to do so effectively based on best practices of practitioners, et cetera, and experiences of other volunteers. And this is a great time to kind of put that out there. So we've been sharing that with volunteers, and to date it seems like it's been working fairly well as they kind of adapt to the new reality. In terms of challenges, as you can probably imagine, not everybody is comfortable with video chat or even remote support. So this is both on the volunteer and the newcomer side. We have had volunteers you know, who maybe aren't familiar necessarily with technology, or they don't like the idea of not being able to interact with somebody face to face. And they've said, you know, we'd rather wait for things to calm down so we can proceed in an in-person format. Likewise with newcomers, there's a lot of situations, there's a few situations where newcomers said, well, we'd rather wait. Nothing's so urgent that we can't wait for in-person interaction. And this is either because of just comfort with video technology, but also with regards to, you know, trying new technology, downloading it, and the technological limitations that some of our newcomers have. Communications and organizations within welcome groups obviously has become a challenge as well. So as you can imagine, it's the same way that it's a lot more difficult to stay engaged over video the way we are now, whereas if we were in person, it would probably be a little bit more intimate. The same way with working within your group, working within a match, it's easier to kind of, for things to fall off or for you to necessarily be distracted if you are doing things virtually. So whether you're relying on chat or even video chat, other things obviously are going on in people's lives, and it's hard to kind of maintain the same level of commitment when you are expected to do so virtually. So what that translates to is that some groups obviously have more dynamic, more engaged members who are comfortable with this format, others less so, and it sometimes creates a bit of a disbalance in terms of who's carrying the weight of the match and the tasks involved. So there's been a bit of support from us on that front. Navigating charity and empowerment. This is a very fundamental concept in all of our work, is the difference between providing charity and providing empowerment and supporting self-sufficiency in newcomers. In these kinds of situations, it's a little bit difficult to kind of make that line as thick as I would like, in the sense that, you know, sometimes with charity, we try to discourage it because fundamentally it's more effective for volunteers to support newcomers understand how to access goods or services on their own rather than having to rely on volunteers. But obviously in extraneous cases like this, it's difficult for me to say, no, you shouldn't, you know, help them with food delivery. You should show them how to use a food delivery service when, you know, the food supply has been cut off and families are stressing about where their meals are going to be coming from. So we've had to be a bit flexible in terms of kind of how to navigate that boundary, and we're still learning how to best do so. Finally, and I've already touched on this with reference to our forced pilot mode, we have been kind of in an experimentation phase. So we don't necessarily know what works, so it's difficult for us to provide guidance and support to our volunteers with regards to what works, what doesn't, and we're still constantly learning. And with that in mind, it's a bit difficult to kind of know that we're necessarily making the right calls or that we're providing the right advice, because a lot of the times we're still learning about what we're helping our volunteers understand, whether it's about service delivery, what newcomers have access to, what they don't, what works best, what doesn't. It's like we're reinventing the program in a lot of ways. So that's a bit of a mind shift for us as well. Next slide, please. So just in the interest of time, I can talk about these more in the questions, but just to kind of share a few stories from our matches. You'll see there a photo, the Toronto Star had featured one of our matches last month. So if you'd like to, you can look that up online. It's a great story about Rami's family, a family of 6 from Syria. They have health complications, which meant that the father, for example, was hospitalized while the outbreak took place. So the family lost access to a vehicle, so they couldn't get groceries. The group really stepped up in terms of providing things like food delivery, helping them navigate health issues. So with the reality of what's going on right now with the pandemic, how to access the same kind of healthcare services that they had before. There's a teacher in the group, in the welcome group. So one of the volunteers is actually a school teacher. She was helping provide classwork, coursework for the kids while they were out of school, helping them prepare for e-learning modules. There's an Arabic speaking member of the welcome group too, a volunteer, and she helped with advocacy, helping the parents communicate with their different service providers. So that was kind of one, it's a large family example of the kind of support that we're seeing. Fatiha's case, it's a single mom from Ethiopia. She has a daughter aged 8. Really her issue is mainly around social isolation, maintaining her language practice, and also helping her child continue with her studies. So the group helped on all those different fronts. She's renting one room in a large house, so you can imagine she's feeling very isolated. The group does regular kind of check-ins, both video and on WhatsApp, helping her maintain what she'd already been learning in her ESL link classes, and also helping her put her in touch with the local school board to make sure that her daughter has access to the technological devices, a tablet, so that she can keep up with e-learning. Finally, Rawa's case, she's from Eritrea. She's a single woman in her 30s. And it's also a story of social isolation. This is actually a case where the match was made prior to the pandemic hitting, and she had formed a very strong connection with her group. They've been doing kind of regular outings across the city, and so with social isolation in mind, they have moved that onto virtual platforms. So they have regular Zoom calls, they practice English, they help her with e-learning of her own. She's doing kind of courses to prepare for work, helping her prepare for job readiness, so getting her resume together, things like that, and more so just spending time. And they've said to me that it's like, you know, our friendship is the same as it was before, except now we can't see each other in person, we're seeing each other online. So these are kind of different formats of how these matches can work. I'm happy to elaborate on these and provide other examples as well. Any questions? Next slide. So just to wrap things up, in terms of what we're doing next, our main challenge ongoing is just keeping up with what's going on. So it feels like every week, Anna can, I'm sure, confirm this, it feels like there's something new that's taking place, some new challenge that we have to address, something new that we have to transmit also to our volunteers. So whether it's schools shifting to e-learning and us helping our volunteers help newcomers adapt to that, to understanding how relief benefits work and don't work for newcomers. Obviously it's confusing for most of us and extra confusing for them. So helping understand what that is and how that's changing. So just really kind of keeping on top of things and sharing that information with our volunteers so that they can then share it with their community as well. Also, this has actually led to we've been very happy to see there's been a lot of goodwill in the public. So we've had a lot of great volunteers signing up. There's obviously an interest in continuing this kind of support. So we've just been mostly trying to kind of harness that and keep up with the recruitment with the new format of our programming in mind. Also capturing best practices. So in normal situations, we're constantly trying to find out what's going on in our matches, what's working, what isn't. And in this case, we're trying to pay extra close attention because obviously this is all new and hopefully this can be put to use in future situations. So we're trying to learn, you know, so when I hear from a volunteer, oh yeah, we tried this new thing on video chat, it worked really well, we're really happy with it. Right away, I want to take that down because that's something that we can share with the rest of our volunteers. And finally, you know, we're still working with all our different partners and stakeholders who are themselves adapting in terms of how they're delivering their own services, sometimes which overlap with our volunteers. And so together, I think kind of collectively, we're trying to harness all of that information so that moving forward, not to say that there's going to be another pandemic necessarily, but thinking through how remote social support works and how these services are rolled out and explained to newcomers, we can inform that process as well. So I'll stop there. That's it. And yeah, I guess we can move on to questions if anyone has any.
Okay, thank you, Andrew. And thank you all for your patience with our technical difficulties with warding off the attacks. Obviously, this colloquium dealing with refugee issues is an easy target for racist and sexist attacks. So your being here, continuing to be here, is a support to refugee support too, in one sense. So thank you. Anna, I want to pick up from Andrew's last point and ask you about the partners, your relationship with partners How can you explain how you are working with settlement sector partners, healthcare providers, academic partners, and funders to deliver to the Welcome Group program?
Sure. So Together Project truly is a group effort, and our partnerships are absolutely critical for our program delivery. In terms of how we receive our referrals, our settlement agency partners know the households, the families, the youth that they are supporting very well, and they reach out to them to find out if they have an interest in forming social connections with Canadians, and if the newcomers themselves express an interest, then they refer them to our program, and we match them with volunteers who we think would be a good fit for the kinds of integration challenges that the newcomers want to focus on. During COVID-19, we've been very lucky to work quite closely with the Crossroads Clinic at Women's College Hospital, which is a local clinic that focuses on serving refugees exclusively, delivering healthcare to them. So they've been super helpful in in helping us kind of sort through the many different economic resources, work permit issues, health issues, COVID-19 information in multiple languages. And we very much rely on these larger, healthcare partners or agencies that have a level of experience and a staff capacity that is greater than ours to convey very accurate information to both our volunteers and our newcomers. As far as academic partners go, I think the main thing that I would just say there is that, again, we really rely on our academic partnerships to create kind of evidence-driven programs that can help us kind of refine the model based on very accurate information and survey data that we're collecting from our matches.
Thank you. Andrew, my next question is for you. Why is it especially important to foster connections between volunteers and government-assisted refugees and refugee claimants during the COVID-19 pandemic?
Yeah, I mean, I think that really everything is heightened right now. For newcomers, for vulnerable newcomers, there's so much uncertainty already in their living situations, in their immigration situations. This is all heightened obviously by the fact that now everything's thrown up in the air and no one really knows how anything works. So the typical service providers have different hours, or they might be closed, or you might have to call somebody different. There's all these different situations that are difficult to navigate at the best of times, which is why our program exists in the first place. But now more than ever, I think that kind of support with service navigation should exist. Social support, as we're all finding out, is extra important at times like these. I think we all understand this now more than ever. And so in that case, I think especially if bonds have already been formed for some of our pre-existing matches, I think it's super important just to stay in touch, to let somebody know that we're still here. We're still here to support you. If you have any questions, you can let us know. But I also want to just spend a second acknowledging the incredible resilience of this population too. I mean, I think arguably compared to the volunteers that are supporting them, from what I've seen from a lot of the vulnerable newcomers that we're working with, the resilience there is incredible. I mean, I think you'll see from one of the from the news story, Rami's family that was featured. I mean, the headline was, we survived something terrible in our home country, and now what I really want to focus on is making sure that I don't fall behind in my language classes. In a way, it's been extremely impressive and heartening for me to see, that resilience. And I think in a way, it's almost reflected on our volunteers as well. So there's this kind of symbiotic relationship that I think is super empowering on both sides. So I think those are the reasons why it's more important now than ever, in addition to all the reasons that it pre-existed as well.
Thank you. Yes, for everyone who has worked with refugees, resilience is definitely a lesson we can learn from them, and community support, actually.
Yeah.
So Andrew, I'll go on with you. Once the social distance requirements are lifted, do you anticipate that you will be able to incorporate new learnings into your welcome group program moving forward?
Yeah, so I touched on this a little bit in my introduction, and it's something I'm constantly trying to stay mindful of, that, you know, there's so much of this is new territory, and it's important to, as opposed to kind of constantly being reactive, be a bit proactive in terms of figuring out ways to capture what we're learning. I think we're learning a lot about the opportunities and the limitations of remote support, and I think that's going to be really important to incorporate into our programming long term. A lot of our, like I said earlier, a lot of our matches have experimented with it in the past, so we had a bit of a head start, but now it's obviously on a much wider scale. But things like, you know, what are effective language practice tools? What's the best technological platform to use in different situations? How different newcomers in with different language levels respond to that kind of practice? Where can it be employed most effectively? So for example, with parents, with children, what are the contexts that we can employ it in the future in an effective way? And also, I think we've learned internally a lot about how we can deliver a lot of our programming remotely as well. So one of the things that we've been wanting to kind of experiment with a little bit, but never had gotten really a chance to get around to it, was, for example, remote training. So we manage hundreds of volunteers. Getting that many volunteers or any volunteers in the same room at the same time is challenging, again, at the best of times. And so seeing kind of what's a good platform for delivering some of our internal support services to our volunteers remotely through platforms like Zoom and others is really useful for us as well, because that's something that we can roll out and we can scale hopefully in the future.
Thank you for those fantastic answers. And my last question is for you before I turn the mic to Galia for Q&A. Do you have any plans to expand the Welcome Group program outside Ontario? What are the necessary elements to scale the program, and what are the key criteria for success?
So we have had some inquiries from different settlement agencies across Canada who have been interested in partnering with us to deliver the Welcome Group program, for example, in British Columbia or in a French-speaking province, etc. So we, in terms of the model itself, we were, you know, fairly confident in the elements that we would want to scale prior to COVID-19. But what we've discovered is this, this concept of fostering social connections actually can be augmented by remote social support. And in some ways, this opens a door for us to potentially serve communities that might be outside of larger cities. So far, our work has primarily been focused in the Greater Toronto area, although we have run a pilot up in Thunder Bay, which is a more northern city in Ontario. But we do feel like there may be some opportunities, as Andrew has said, you know, to foster social connections, not only between volunteers and newcomers who are living in the same community right next to each other, but potentially there may be some opportunities to connect volunteers who are living, you know, further afield from the newcomers. And so as we look into scaling our model, we're going to sort of very closely look at the kind of pros and cons of matching people, you know, who live within a short car ride or a transit ride away from each other versus matching people who are maybe slightly farther afield.
Thank you for those wonderful answers. So Galia, if you're ready, I can turn it over to you for the Q&A.
I am ready, and we've collected a few questions. There haven't been, I know it's been a very chaotic session, so I also wasn't able, normally I would have my own questions, but I was busy moderating who was in the session. So thank you for your presentation. So one set of questions is about your volunteers. I know you've spoken quite a bit about them, but a few participants wanted to know, how do you originally, you said you have over 100 volunteers. So how long did it take you to recruit those? You know, how and where did you recruit them? How long do they last? And then what kind of, you talked a little bit about the training and support, but, you know, if you could elaborate a bit more on how you maintain, I think the question is, how do you maintain their engagement, and how long is that generally for? How do you train and support them, and then how do you keep them?
I can take this one, Anna.
Yeah, sure.
So, I mean, we can spend a lot of time talking about how our program normally works. In terms of volunteer recruitment, it's a cop-out answer, but it really comes from all directions. My favorite form of recruitment is word of mouth. So volunteers who have experienced the program in the past and can think of people in their own social networks who would be a good fit. That's a fantastic kind of early vouching system for us to kind of expand within that volunteer's social network. Really, we've kind of recruited across the board, everything from university campuses to, you know, volunteer sites, to job sites. Certainly media always helps whenever we have a story in a newspaper or online somewhere. People seem to, you know, see it as a kind of a call to action, which we always really appreciate. We have very good search engine optimization, it seems like. We have a lot of volunteers who say that they've heard of us because they literally typed volunteering with refugees in Toronto into Google, and we're one of the first sites that pops up. So I think we tend to attract a lot of volunteers who want a more, I'd say, kind of profound or more frontline form of volunteer experience rather than kind of a one-off session or one-off interaction or an event-based volunteering. This is, it's much more intensive. It's much, you know, it's a more involved form of volunteering for sure, but also I think the rewards there are much higher. You're forming a very close social connection with a vulnerable population. And to that end, to address the questions of training and support, we have a fairly thorough vetting process to begin with, as you can imagine, working with this kind of population. So we do an interview, there's a vulnerable sector check that we run with the local police service. We do a group orientation that introduces some concepts that a lot of our volunteers might not be familiar with. So things like trauma-informed care, cultural sensitivity, what I mentioned earlier about the difference between charity and empowerment. These are all concepts that we want to load our volunteers with so that in their own interactions, when they're working independently with vulnerable newcomers, they're mindful of those things. And also just fundamentally how refugee resettlement works, what effective volunteering actually looks like, how to navigate these services. And then in terms of support, we don't get actively involved in individual matches. We want that relationship to become organic, but we certainly provide support in terms of managing communications challenges or managing specific resource navigation. So for example, if they're looking for a specific kind of doctor that speaks a specific language that is applicable for a specific kind of healthcare package in a specific neighborhood, the average volunteer might not necessarily know where to immediately go look for that kind of information, but we've now done this quite a few times. So we can kind of help connect those dots, but the actual legwork then is carried on by our volunteers. Yeah, we have worked, I think now with at least, we're over 600 volunteers in the kind of the full run. The thing I want to flag with that number obviously is that these are not necessarily 600 volunteers that are active all at the same time. Otherwise I'd have a lot more gray hair, I think. It's roughly around, I'd say 150 active volunteers at a given time. Our matches last formally for 6 months. After that point, they can continue on indefinitely on an informal basis, and a lot of our matches do so. So that's kind of a happy outcome for us. It becomes an organic relationship like any other. We don't necessarily need to kind of provide an umbrella for that relationship. Recently, we had a fundraiser where one of our earliest matches, so it was now 3 years ago, was featured at the fundraiser, and they're still in active communication. They still see each other every week, which is a fantastic outcome. Other groups at the 6-month mark decide that those priorities have been addressed, or the main priorities have been addressed, and they're ready for a new challenge, and they meet a more recently arrived family with more discrete challenges. So these are kind of the two paths that we see for our volunteers to take. Either they can kind of really develop a really close relationship with a specific family or household, or they can use those skills and that experience to help afresh with a more recently arrived family. So we've had groups that have now been matched 3 or 4 times, which is fantastic because that way we can kind of retain those resources and that knowledge within our volunteer base. I hope that addresses all those questions.
Yeah, no, that was great. And the next question relates to that. And again, if you had responded to this and the chaoticness of everything that was going on, maybe you could just briefly touch upon it or just say that you did. But one of the other question was, in what way have you studied your own work in terms of program evaluation? I mean, you just mentioned that it's a 6-month formal program. So do you have an evaluation at that time? And then do you have also maybe a longer term evaluation to see what happens over the longer term? How is 6 months enough? Do you need more time? How did you arrive at that? It seems to me probably that most of them, and from my own experience, go on for 5 years, or so. So, what kind of evaluation have you done, and what are your findings?
So there's been a few different forms of evaluation that we've tried. And I think some of the figures are in the slides that Anna reviewed in terms of some of the kind of satisfaction surveys and things like that we've seen. The overarching question that we're always trying to figure out is what's the highest and best use of volunteers in supporting vulnerable newcomer integration. So with that in mind, what we're using to evaluate is always kind of changing. Initially, we were really focused on outputs, just kind of how many matches are we making, how generally satisfied do our volunteers and newcomers report being, and that's kind of our basic metric for success. Over time, we've learned that it's actually more important to kind of focus on the outcome. So in terms of the priorities and challenges of the newcomers that we're working with, what effect are our volunteers actually having on moving the needle in those different priority categories, while at the same time, from a programmatic point of view, making sure that our volunteers are also having an enriching and empowering experience themselves, because we want them to stick around and we want them to keep supporting. So the simple answer to your question is we do administer baseline and exit surveys. So at the outset of matches, we kind of take down as much information as we can about our volunteers and newcomers, and at the exit, we try to kind of track on that information, on that baseline information with a follow-up survey. And we're also constantly doing check-ins to kind of gather, qualitative information just about what's working, what isn't, and how satisfied volunteers and newcomers seem to be with their match. The 6-month mark, you're absolutely right. I should also say that 6 months is certainly not the full extent of the average vulnerable newcomer's integration journey. It does take many, many years. But simply the reason we chose the 6-month mark is by that point, we typically find that the kind of low-hanging fruit of challenges are typically addressed, or at least there's an understanding of where volunteers can play a role, that after the 6-month mark, there's really no amount of support that we can really necessarily provide. Hopefully by that point, having developed a relationship through addressing these priorities over those 6 months, they've formed their own relationship that continue on longer. So we help them understand what language challenges exist, how to address those challenges, and at the 6-month mark, hopefully they can take that information and continue with that newcomer's language learning journey, for example. So the longer term evaluation is a great question, and that's where, like I mentioned, we're working with a number of academic partners to kind of figure out what the best evaluation framework for us to use is. So stay tuned, I guess, is the easier answer to that question. We're still trying to find that out, but we're doing the best we can to kind of understand what's working to date.
Thank you. The last question, as academics, we always take issue with terms like vulnerable. At the same time, we know, that people have different vulnerabilities. And so I would think in this time of the pandemic, when we realize everyone's vulnerable to different conditions, the final question has to do with your own vulnerabilities. And it comes to us from one of our participants, and saying you've spent years developing procedures, and now you have to quickly modify how you accomplish your own goals in this new vulnerable world. And in addition, you suddenly have to focus on helping your clients within the context of a potentially deadly disease, which increases your own focus and anxiety. How do you care for your volunteers and staff as you face the realities of how the pandemic can affect your clients? And how do you, Anna and Andrew, take care of Anna and Andrew? And I particularly like this question because, we like to, there is a term, and I know for funding and other purposes, you're helping a vulnerable population. And I think that this pandemic really raises that question well, in terms of what it does mean to be vulnerable. So.
Yeah. Andrew, maybe we can both comment on this,
Sure.
but I just wanted to pick up your thread about the resilience of the population that we're serving. And I think it's really inspiring and, brings us both, to our desk every day to realize what many of the newcomers that we're serving have endured just to get to Canada. And that, you know, if we can find within ourselves the resilience to respond quickly to this situation and to really try to work with stakeholders and learn from our volunteers and learn from the newcomers, frankly, about, you know, how to adapt, how to innovate, and how to form community when there are a lot of constraints on social connections at this time. I know for me, that's certainly a big part of my motivation personally for wanting to respond, you know, quickly at this time. In terms of, you know, like self-care, caring for our staff, caring for our volunteers, we did do a needs assessment right after COVID-19 began. We reached out to most of our matches just to ensure that volunteers who had originally signed up to be involved in one kind of program and now we're going to have to be involved in a different model involving remote social support, that they still wanted to continue to participate. And, you know, Andrew may want to comment on this more, but for the most part, I think just as we are finding some, you know, meaning in doing this work right now and being inspired by our newcomers, I think some volunteers are really also finding like a sense of purpose and community in this work when they may be facing losses in other areas of their life, whether that's loss of employment or frustration at not being able to connect with family members in person. Maybe I'll just leave it there, Andrew, and if you want to sort of comment a little further.
Yeah, first of all, thank you, Larry, for asking the question, because it's one of those things where sometimes I think that if no one asks you, you drift on and you don't realize necessarily that it's important to kind of think about who's supporting the supporters, who are supporting the supporters. I think it's a very important question. What I've learned from working with volunteers over these last 3 years is really that it's a bit of a disconnect from how we think about kind of program delivery when we're talking about widgets and kind of basic services. We're talking about people, and we're talking about people who are not experts, who are not, you know, veterans in this field, who are learning a lot for the first time. Patience and tolerance, I think, is a really important asset to bring into this kind of program delivery. If a volunteer finds something very stressful and needs to take a break, despite the fact that obviously we ask for a certain kind of a level of commitment and responsibility for our volunteers, a lot of this is uncharted territory, again, in the best of times. And now with this added layer, I think we have to be especially careful of our volunteers to understand that we are asking them to do a lot. We are asking them to kind of invent something that they're not necessarily in the best of times comfortable with, or they're still learning about. And so I think I've taken quite a bit of extra care to kind of communicate with our volunteers, to kind of check in on how they're doing. And so the same way that we're communicating with our colleagues on a regular basis via Zoom or other platforms, I'm spending a lot of time sitting on my couch talking with my volunteers. And like Anna said, I've been speaking to a lot of people who have been, you know, losing their jobs, or they feel like they're not as effective when they're supporting over remote support. They don't know if this is the best use of their time. And I think the same way that they're providing a voice, just a kind of a voice of support to vulnerable newcomers, our role is to provide that voice for them, to kind of walk them through that situation. And I think taking it a step higher, for ourselves as well, I think Anna and I, we've been working together for some time. I think we have a very kind of open and honest working relationship, and we can, you know, we provide a bit of a sounding board for each other too, if the situation is especially stressful. We're mindful of that kind of self-care component as well, to make sure that we're not burning out the same way that we're hoping our volunteers aren't burning out, and being mindful of the fact that this is a high stress environment, even more so when, like you said, you're dealing with a deadly disease that causes even more anxiety. So I hope that addresses that question.
I think that's it for the questions, Donna.
Thank you all. And thank you for these wonderful answers, and thank you all for sticking with us. Do you have any final words, Anna and Andrew?
I mean, I guess I would just say that we're always learning from different people in the larger, you know, refugee resettlement community. If anyone wants to reach out to us, Together Project really is a group effort. I think on the slides you'll find contact information for Andrew and me. But we really appreciate your interest, and stay in touch.
And thank you to our moderators as well.
Yeah. So yes, I would like to thank Danny and Cindy for today, the extraordinary effort that they made to keep this going. And Anna and Andrew, you both did a wonderful job despite the disruptions. So thank you so much. I would like to remind everyone that this is a regular series, and next week we will be talking about the COVID-19 pandemic experience of refugees in Brazil, and the following week we will be focusing on Turkey. So please join us for the future webinars, and we will definitely establish a stricter security protocol, I can assure you of that. And thank you so much for joining us today. You can find out about our future topics on our Facebook page, and you can listen to the recording. You can find the recording of this the webinar on our YouTube channel after quite a bit of editing. So thank you all. This is it for today. We hope to see you again next week.
Thank you very much.
Thank you, everyone.
Bye.